talked about how you had to basically advocate for yourself, right? And I'd read somewhere in a different interview that you said sort of this self-diagnosis journey can raise eyebrows from the medical community. And, you know, coming from someone who's already a physician, that's one thing. For patients who are often told, you know, don't, you just listen, or we know better. I'm just curious what your message is now that, I mean, because you've stood on every sort of corner of this sort of, you know, position here, the situation. Yeah, what's your message to people about that?
Yes. So I think the paradigm you're describing, and I know it still exists in some places, is paternalism, where the doctor has all the power. And I actually was telling someone yesterday, because we were having a really wonderful kind of conversation about the pros and cons of really 3 different options. We'll talk about how you make it so it's not a la carte medicine for the patient, but they still feel empowered to make choices. We'll get to that. But anyway, it used to be someone like me in a white coat, very stern, comes in, first appointment, you've got cancer. We kind of brush that aside very quickly, and then we tell you what you're going to do. That used to be the exchange, and it felt very kind of unidirectional. What I would tell patients now, Stephanie, is, you know, we live in the information age. We have more access to information than we've ever had before. And I realize, again, that the playing field is not perfectly level. One of the things that frustrates me, even as a self-advocating patient, is when I try to get really deep in the weeds and research things, I sometimes come up against paywalls. So a lot of research, even publicly and federally funded research, ends up being put in journals that are financially inaccessible. It's not uncommon, and you may have done this. If you're trying to get a single article, one article, it might cost you like $60 just to get your hands on that one, you know, piece of paper. And that really, really frustrates me. And then honestly, some of our research findings are necessarily behind closed doors. And what I mean by that is, you know, they're not ready for prime time yet. Unfortunately, oncology is littered with examples of things that have been biologically plausible or even looked very promising in very early phases of drug development, but then they don't actually work when you put them out and study them either in the human body, so going from a test tube to a person, or in large groups of people, especially, you know, in a randomized clinical trial. So those 2 things aside, though, I would argue that most patients have access to the same information their doctors do. The question is, how do you filter it? Because as you well know, you know, an engine like Google is incredible, but it's also gameable. You know, Google is not, you know, it's not a completely altruistic organization. There's a reason you get this in exchange. The transaction is you, it's your information. Regardless, you know, where I want to empower patients is, if you feel like, this is what I'll say, if you feel there's something wrong with you and you feel like your doctor is not helping you deal with it, you are entitled to a second opinion. And one of the things I say is, if you ask for a second opinion and your doctor says no, that is a reason to get a second opinion. Because any doc these days who thinks they know it all, especially in oncology, is absolutely kidding themselves. There is so much to know. I don't know. I know a lot of smart people. I don't know anybody who knows everything.